task is pretty. So we have to speak about the sick files. It means to treat several diseases, not so just one. And so the indication, as you know better than me, there is any age, as the speaker who just told, Helsinki, you can correct. You have almost 6 months of predicted growth and idiopathic deformities as well as sacrifices and successful on all planes of deformities. So contraindication, just one point, is physiological deformity and closed physis, otherwise the 8 blade doesn't work, and skeletal maturity as well. So advantage, Peter Stevens says we have no need any immobilization. We can have early weight bearing, so early return to daily activities, and we have also low surgical risk and low cost as well. Is in this time is not so bad. So ideal implant, as you know, is extra-periosteal, extraphysial, flexible, easy surgical technique, either implant, either removal, and safe for the fibers in order to avoid the risk of producing fissile bar. So the first case is a boy, 8 years old, with congenital hypophosphatemic rickets and growth hormone deficiency with valgus deformity of his knee. So this is the implant, is not perfect, but anyway, is one of our first cases. This is the pictures after 2 years post-op, and this is 1 month post-hardware removal, and 1 year post-hardware removal. In order to see, you can see there is no rebound effect after the hardware removal. Another case is a bone disease. I never see, probably here there is many people who is very skilled with bone disease, but me in Italy we never seen since a few years ago the first cases. And this guy, this is a girl, she comes from Africa, but this is bone disease. This is an X-ray, and this after just only 6 months post-op. You know, the trick probably is to take the disease when it is very early, otherwise probably it doesn't work. This is a girl, 13 years old, with a hyperparathyroidism and valgus deformity of her knee, and 2 years and 6 months post-op. We have a good correction. 5 years old is a valgus deformity post-infection. So he's a guy who comes from Romania and had probably something wrong in his infection on his knee. This is the X-ray. You can see better the knee, which is the defect. And so we tried to put the next one 8 plate. And so 1 year and 3 months post-op, you have a good correction and a realignment of his limbs. That Serician is not probably a true physis, but anyway, it's a flexed knee in CP patient, so is pretty old because he is 13 years and 7 months old. So we have 2 alternatives. The first was classical in surgery with osteotomy, but we explained to the family we can try because we had some potential of growth, so we implant with the plate anteriorly, and you can see 9th month post-op we have a good correction, and we even here you can see the patient is in can you yes is in the sitting position, so you can see it's a straight knee. Lawrence is a boy, 13 years old, with a chronic kidney disease. We have in our hospital a nephrology unit, so we have a lot of patients with kind of deformities because the chronic kidney disease several times is linked to the deformity of the knees. So this is a guy with a congenital renal dysplasia, and this is 18 months post-op, good correction, I think. So Ricketts is Christian. He comes from Iran, and at 9 years old, he has some parents an ankle in Italy. He came with this X-ray and this clinical presentation. And so we put the 8 plate and 2 years post-op. We have good correction. It's not perfect, but anyway, it's much better than the beginning. So Down syndrome, sometimes we have a patient, we are overweight, and you know Down syndrome is linked to the patellar dislocation, and sometimes the valgus deformity is directly responsible, or anyway can increase the possibility to have the dislocation of the patella in this subject. So we started to operate with an 8 plate. This is a 12 years old boy. And 11 months post-op, we have a good correction. He is still fat, but anyway, his knee works. So this is just one look on the possibility in hereditary multiple exostosis disease. We have a deviation of the knee due to the exostosis close to the physis, so in the metaphyseal region. So we cut off the exostosis, and just only 4 months post-op, because it is not really a sick physis, so it works very well and very fast. This is a guy we surprised myself, because he was 12 years old with hypothyroidism in chronic kidney disease and history of leukemia, and a very severe valgus deformity on his knee, and but after 1 year and 2 months post-op, we have a good correction of his knee. And at the end, so this is a girl who comes from Cabo Verde Island, is 6 years with a spondyloepiphyseal dysplasia with a subtype Kotzevich. Don't ask me too much about this subtype, please. But this is a severe deformation of the knees, and this is the X-ray. And we had a little bit scared about the bone cavity in order to have the good, the good tight of the screws. But 1 year and a half after the operation, we have a pretty good correction, and in this way we can avoid major surgery thing. So this is just for discussion, probably someone, and Dr. Stevens, I discussed with him. This is 3 years old in a case still in treatment, so we try to correct this severe hyperthyroidism with Cox-Savara with this kind of surgery, and this, you can see on your right, the last X-ray is August of last year. There is a little bit improvement, but it's not yet completely correct. Anyway, so if the question is it worth it? So we can say we can have a very safe outcome.
I can see him. I lost the center. Oh, thanks, bye.
Okay. So we have an unpredictable outcome because we have to treat the sick physis. So we have a bizarre behavior because the sick physis is not the same behavior during the growth, and there is a slow growth, and in this way we take a long time of correction when we treat this kind of pathologies and these children. On the other hand, we have in our hands easy surgery with a repeatable surgery. In the case we have a rebound, we can go again in the OR and put in again the 8 plate, and we can avoid major surgery and otherwise postpone major surgery and decrease the severity of future correction from the patient and for the surgeon as well. So the answer to the question, yes, it is, in our opinion. Thank you for your attention.